My name is Bailey Giddings, and I am going to be telling you about the article, Repetitive Strain Injuries of the Skeleton in High-Performance Equine Athletes by Christopher M. Riggs and Rob Pillsworth. During this presentation, we are going to talk about stress fractures, particularly those of the scapula area, subchondral bone disease, the detection of exercise-related injuries, how to treat those injuries, and the most important, avoiding strain-related injuries. Stress fractures are the most common stress-related injury in equine athletes, and they can be developing for a period of time before the horse even starts to show signs of pain. So it is very important to keep close observation on your horse just to make sure there is no lameness showing, or if you do a palpation, just to make sure there's no inflammation. And this can occur at any bone. The one I am going to tell you about is the scapular stress fracture. Now, when this is detected, the training should be suspended right away. And this particular stress fracture is often very unnoticed because the signs do not appear immediately. And when something is suspected, radiography is used, and this requires certain projections of the extremity in order to locate the injury. So if that leg is not positioned in a specific way, the injury will go unnoticed. And unfortunately, when it does go unnoticed, it can progress and become really severe. As you see here, there is just a very, very, very small fracture that you can't even really see. And then as time goes on, it does begin to worsen, and you can clearly see that there is a fracture in the scapula here. And if it's left untreated or unnoticed for too long, it can become very severe, in which case the horse may even have to be euthanized. Another exercise-induced injury is subchondral bone disease, and this can result from the continuous strain of tissues during exercise, so it's very important to make sure you have a proper training routine and that the horse is getting adequate rest time. And what happens in the development is that the cartilage begins to wear away, and bone spurs can form, or even fractures can start to develop in the underlying bone. And the typical locations affected are the carpals, tarsals, and condyles. So it's very important to palpate the horse's legs to make sure there is no inflammation or anything abnormal being felt. And some other detection methods can be by watching the horse's gait. You'd want to make sure the horse isn't limping and showing signs of lameness. And the telltale sign of subchondral bone disease is when the horse is unable to fully flex the carpus. If something is suspected in the horse, it is important to go to a veterinarian and have a radiographic examination performed. But like stress fractures, the leg has to be positioned at a specific projection in order to pick up on the injury. And here we are going to see the progression of subchondral bone disease. This right here is the normal appearance of cartilage and bone. It's healthy. There's no wear lines in the cartilage. As it starts to progress, if it's unnoticed or untreated, you can clearly see the wear in the cartilage. There's wear lines, and the stress starts to have an impact on the underlying bone, and you can see here in the darkened areas that is a sign that the bone is starting to fracture. And if left untreated, it will become severe. The wear lines in the cartilage are highly observable in this image. And this one also had a condylar fracture, and the horse had to be euthanized. Managing subchondral bone disease is the basic. Training and performance needs to be reduced or suspended altogether. It is recommended that the horse has a stable rest of 1 month. And you need to go to a veterinarian right away, and a radiographic examination will show the subchondral bone disease. And you need to listen to the vet's advice on how long the stable rest should actually be and how long the training and performance needs to be put to a stop. After the recommended time frame, you need to take the horse back to the veterinarian for another radiographic examination, and it needs to appear normal before resuming the regular routines. An important step of exercise-induced injuries is the detection. And in order to detect it, you need to have constant observation of your horse. It is very detrimental. You should watch the gait of the horse. Once again, make sure there are no signs of lameness. You can look at the appearance. As you can see in this picture, there is some inflammation in this hind quarter, and the horse is reluctant to put any weight on it, and that is a sign that there is an injury. And also palpation can feel for swelling and inflammation and any abnormalities. If anything is suspected, you need to take immediate action and have a full examination done by a veterinarian. And the vet will use techniques such as ultrasound, radiographic examination, MRI, scintigraphy. And what scintigraphy is the horse will be injected with radiopharmaceutical uptake, and this will migrate towards the soft tissue of bones, so it can show where impairments are starting to form, and it is called increased radiopharmaceutical uptake when this happens, and it allows for early detection of the impairment so that the proper treatment of the injury can begin sooner. And here's just kind of shows the differences between scintigraphy and x-rays. As you can see here in A and B, this is the x-ray of the hoof of a horse. In A, you cannot really detect any injuries showing, but in B, you can see a slight fracture starting to form. Whereas in scintigraphy, this is where the radiopharmaceutical uptake shows, and this is actually from a distance, so you don't even have to have close-up imaging to detect the injured area. You can just clearly see where there is a dark area that there is an injury starting to form. So scintigraphy is a recommended method when it comes to detecting stress-related injuries. The next step when something is detected is to treat the injury. And the most important way to do this is adequate resting period. You need to listen to the vet on this just to make sure that there is time for the injury to heal and to make sure that it will not be a reoccurring injury. This is determined by the veterinarian, and during this time there is to be no training and no performing, and often stable rest is recommended. And also you can splint the injured area, so by putting a splint on the leg, it will help to kind of stabilize the bones in there so that the injury is not able to progress. Occasionally steroids are used to help strengthen the injured area. The horse needs to be examined again before returning to their exercise routines. And the horse needs to be eased into routine. You can't just go back to having that full-blown performance again. It needs to be slight, just like when you're starting to train the horse for the first time. The most important thing when it comes to exercise-related injuries is avoiding the injury altogether. And to do this, you need to allow the horse to adapt to the training routine. So once again, just kind of ease into it, start slow at first, and work your way up over a period of time. During training, the skeleton becomes more durable, so it is important that you give the skeleton time to adapt to the training, so that way it doesn't become more fragile instead and have negative effects on the horse. The tendons and ligaments will become stronger when the horse is eased into the training, and it benefits all systems used during exercise, not just the bone side and the skeleton side of it, but also the respiratory, the cardiac, all of that will benefit when you allow the horse to adapt. Proper nutrition is very important. You don't want the horse to have carb overload. That can cause lameness and induce stress-related injuries. And you also want to adjust training to the weather. There was a study done on British thoroughbred racehorses during their training. Now the white lines here are from 1998 and the black lines are from the year 2000. So this is kind of the change throughout the years. And it was noticed that in both years, stress fractures were more likely to happen in the areas or in the times where there was warmer weather. During warmer weather, it is suspected that the bones become more likely to acquire fractures due to the horse sometimes being dehydrated and they fatigue easier. So you want to make sure that you kind of reduce the exercise during the warmer months like June, July, and August, and also make sure the horse has plenty of water and proper nutrition to avoid the stress-related injuries. And whether your horse is used for barrel racing, cutting, other rodeo events, or it's a pleasure horse used for trail rides, or even if you're doing English riding, it is very important to make sure you are taking proper care of your horse to avoid exercise-induced injuries. And here are my works cited. And thank you.